is Haley P, and so we're outside, so I have my mask off, but when we go in the building, I'm gonna put my mask back over my face. I'm about to give you guys a tour of the School of Medicine, UMC. Also gonna answer questions along the tour, so y'all be like, feel free to like put questions in the chat, and I'm gonna answer them as I go. I already got a few questions on my story, and then I'm gonna answer those too. So I'll just start with the introduction of myself. A couple people had questions about me and my journey of applying to medical school. If y'all have any problems with hearing me, like make sure you like put that in there so I can know. Anybody say anything about problems with hearing me? But I know outside it can be like wind sometimes. Okay, so right now I'm a second year medical student. I was born and raised here in Jackson, Mississippi. Let's see here. I went to Alcorn State University for undergrad. Some of my extracurricular activities, I was in the band, and I was a Alcorn State University Golden Girl. I'm a member of Zeta Phi Beta Sorority Incorporated, and I was in the Alpha Chi Sigma fraternity, a bunch of other things. I was a very active student on campus. I applied to medical school a total of 3 times, and I took the Mcat 4 times before I finally got accepted to UMC. So the first time I applied to medical school, I was like going into my senior year of college. I think that's the first time people apply going to medical school, because like a lot of people want to go straight to medical school after college. Oh yeah, let me say the person holding the camera is Robert Tatum. He's my colleague. He's also a second year medical student, and so he's like holding the camera and assisting me with today. He'll probably be like asking me some questions and things. So yeah, I applied going straight out of undergrad, and I didn't get accepted. I didn't get any interviews. All I got was secondary applications. Felt a little discouraged, and so on my graduation day, I remember thinking like, what am I about to do next? Because I had no idea what I was going to do next. And so I decided to do a post-bac program. I went to Mississippi College, and I got my master's in medical science, and that is a great program, y'all, because a lot of classes they teach there are classes you'll be taking in like your first 2 years of medical school. I took gross anatomy, histology, neuroanatomy, biochemistry, the biology of cancer. A lot of these courses that were like help me out when I got to medical school, and it really did make my transition better. So I applied when I first started the program. So for a little background, I graduated in May of 2017, and then that following summer in 2017 is when I started my master's program. I started the summer, and then I applied in the fall again to medical school after taking the MCAT again. So this time it was my 3rd time taking the MCAT, and I had not reached a score over 500 at this point. And so when I applied this time, I actually got interviews and secondary applications and stuff of that nature, so I was excited. I didn't get accepted this time though. I was finishing my master's degree, and I was actually waitlisted here at UMC. And so when I was waitlisted, I went to what they have is called pre and post application counseling, and I basically they tell you what you need to do to become a better applicant or more competitive applicant. And so some of the things they told me was that I needed more shadowing hours, to like redraft my personal statement, work on my application, and to try to up my MCAT score, because I didn't have problems with my GPA. I had a lot of like experiences as a student, but there were those like metrics, like MCAT and like shadowing, that I needed to improve on. So from there, I did this shadowing program that lasted 6 to 8 weeks, and I shadowed in neurosurgery here at UMC, and I secured a letter of rec from the doctor that I shadowed here. So after that, by this time I graduated from Mississippi College, and then going into my gap year is what they call it. I wasn't in school, I wasn't doing anything. I was working at Mississippi College as a TA. I got a job as a medical scribe, and then I also worked as a waitress during this year. So I had 3 different jobs, just working, saving money. And then after I graduated from Mississippi College and had got the shadowing hours and gotten a job as a medical scribe, I applied again after taking the MCAT again, and finally my score passed the 500. And so I felt confident going into this last time. And so by this time, this was my 3rd time applying to UMC, or not UMC, just medical school in general. And by this time I was kind of like fed up, and I said, you know what, I'm just gonna put my all into this application process, and it's gonna be my last time applying, because at this point I was like, I need to get out of my mom's house. And so I actually got accepted. Like there's always a date the first date that you find out if you're accepted or not when you apply a regular decision, and I found out that day. So I basically checked all the boxes they told me, my pre-application counseling, and I just like put it into fruition, put my all into my last time, and I finally got accepted, which leads me to now here I am at UMC. I think I answered all the questions about my application process, but it was a very long journey getting into med school, y'all, but I made it, and you definitely can too. Make sure I did all that. Yeah, I said everything about it. And so someone asked, one of the questions I got was, is it frowned upon, and I'm gonna read it verbatim, is it frowned upon if you go off and do other things while you slowly prepare to apply to medical school? My answer to that is no, it's not, because medical schools, they like people who are well-rounded applicants with a lot of experiences to offer. Some of the things I did between graduating college and applying to medical school, I had a job at Chick-fil-A, I had a job as a waitress, and of course I had a job as a medical scribe. And I remember using my job at Chick-fil-A on my medical school application. I talked about how I was able to interact with different people from different backgrounds, and I used that to my advantage when I was applying. And I thought that was a really good way to twist something like that, because people don't think that like working in like fast food could actually like give you skills of being a good doctor, but as a doctor you're going to come in contact with all different types of people. So that's how I used that, and I thought it was a really good experience. So no, use your experiences and use your time when you're not in medical school to enrich your application and your experiences.
I have a question.
What's the question?
Vanna Jane said, I am currently trying to find hospitals that would hire me as a scribe, but I'm struggling. Do you have any advice on how to find these job availabilities?
Yeah, so when I was applying for a job as a medical scribe at Mississippi College, they had this like a group where they would post like different jobs. My job as a scribe was with Scribe America, and it's basically like a scribe agency. It's not specific to Mississippi, but you can like see what jobs are available in Mississippi, and I think that's similar for a lot of different scribe jobs. I worked at like Merit Health, and so I was trying to go to a scribe website and see what's available in your area and just apply there. It's on the job training, so you're gonna learn basically most of the stuff that you need to be a good scribe, and a lot of stuff you learn on the job. So that's how I found out about my job in Mississippi College, but as a scribe. In a medical scribe, a job as a medical scribe, basically what you're doing is you're just like typing as the doctor talks to the patient. So it pulls the doctor away from the computer and allows them to interact with their patients more while you're recording the encounter, making sure that you're communicating with the doctor about the treatment plan and stuff. So it's a very valuable experience. It's basically like paid shadowing, but you're actually learning how to document encounters, something that you have to learn in medical school anyway. I really like my experience as a medical scribe. I was a medical scribe in orthopedic surgery. I don't want to do ortho though. I'm not a what they call gunner.
She asked a follow-up question. Did you have to take a certification course?
Yeah, you do. At the end of your scribe training, you do have to complete a certification course in order to continue scribing. So they won't just throw you in the job and assume you know everything. They test your knowledge to make sure that you know everything they taught you. Like, and it goes into like medical terminology, making sure you know what to include in the notes, what different parts of a note are. So they test you on all that to make sure that you're prepared to go on the job. Any more questions on that? I hope they answered your question. Those are really good questions. But a medical scribe is a good job to have as a pre-med student. You can even do it. I think some people scribe in medical school, and that's a whole nother topic. I don't really know about working in medical school because I didn't do that. But yeah, some people do it. Okay, so we're finna go into school. I'm put my mask on, and we finna tour the facilities because we where the admissions reside. Okay, let's see here. I really hope nobody is bothered because I tend to speak very loudly.
Good, thank you.
Okay, yeah. So here we are. This is the School of Medicine. This is where you will live your first year of med school and some of your second because you do a lot of studying here. So over here is the Office of Admissions. And here's my pearl about the Office of Admissions. So when you're applying to medical school, these are the people who will give you your first impression of the school, and they know that. And one thing I liked about UMC is these people are very friendly. They actually help you. They will talk to you, give you advice and stuff. That was my experience. I felt like it was a family environment, especially when I was interviewing here, and that drew me to UMC. So kudos to the admissions department. They're doing a great job here at UMC. Let me see if I can jump on Instagram live on here. This is the Administration office. A lot of big people have offices in here. One office I would give a shout out to is the Student Affairs office here at UMC. They basically anything that you have a problem with as a student, you can talk to them. Like if you have to miss class, there are people that you can email. They basically deal with what's it called, student affairs. All of your affairs as a student, there'll be people that you will be contacting with. So the people over there are who you're talking to as a pre-med student. But once you get in school, you're gonna be dealing with these people. But let them tell it. I always be in the admissions office.
You hear me?
I always be over here.
Do you hear me? That's where I'm gonna reside.
Here we are. You can see up here in different hallways, they have like class pictures. These are the more recent graduates. They don't have 2020 up here. Oh, yes, they do.
Up there.
They have 2020, but they actually have like all the different graduates from different classes. I can't wait till I get up here. So if this is 2020, 2021 gonna be right here. I'm guessing 2022, so I'm gonna be right here in this spot. It's gonna be my spot on the wall.
Period.
So as a first year medical student, your locker is gonna be over here in the cut. See, I had lockers over here. This is where the first year medical students had their lockers. Get a lock for your lockers, but at UMC we all live by the honor code. So that's one thing I respect. If I leave my stuff unattended in the room, I really am confident that nobody's gonna touch it. That's because you need access to get into this building. It's a badge access. But there's nothing wrong with getting a locker, but nobody gonna touch your stuff because we live by the honor code here, and we respect that. Where admissions reside, where admissions reside, I'm trying to talk. Oh, shout out, these scrubs are from Imani Med. They're owned by Marjada Tucker. She's an M3 medical student. I had to make sure I repped her for today.
See you later.
Hello, y'all. Hope y'all can hear me, but this is a coffee shop. Look, medical students. We need coffee, fam. This is what we drink. This is what we live off of. I'm be real. I didn't start drinking coffee until this year. So I really went my whole first year in med school with no coffee. Some people say I'm God's favorite, but there are a lot of people who don't drink coffee.
For goodness sake.
School, but they got one right there if you need some coffee while you're studying. Okay. So I'm gonna walk y'all to the student lounge. Man, my first year in medical school, we went to student lounge like after every test or to take any study break. It's probably one of my favorite places in the building.
This place is literally a little home.
Right. So yeah, this is the student lounge. I'm gonna just give you this tidbit that I think everybody says about UMC. You can really appreciate the natural lighting in the building. Like, you can see outside. Look up from your textbook, and you can look outside and see life still going on around you. Okay, so this is the student lounge, y'all. Hey, y'all.
What's up?
I'm doing a virtual tour. UMC.
These are the microwaves.
So this is the student lounge. That's basically what it is. The M2 lockers are in here. So my locker is in here as a second year medical student. We got microwaves. They got 3 refrigerators. And guess what? It ain't a white refrigerator. Y'all seen that? Who was that on Kim Pop?
Yes.
And she was like, oh my God, a white refrigerator. But no, they got 3 refrigerators. And so students will put their food in this refrigerator, put their name on it, and just come and eat it. Now they will throw away your food because we have students who are in charge of making sure they clean this refrigerator out like consistently, make sure it's clean. So you leave your food in there, it probably won't be there 3 weeks from now. I hope it won't.
It's a sign that says it.
Right. All right, y'all. This is the best part of the lounge. Y'all see this? This ain't the part where I play, but we got games. Games, okay? I don't even know who games these are, but they always in here. And some of the games we always play are Super Smash Brothers.
Love it.
Talk about taking your anger out about histology. Super Smash Brothers. I used to always get beat by Robert.
It's true, but she used to be so annoying.
Smash Brothers, I use the same move over and over.
And goodness God, it works for some reason.
Yeah. Yeah, but this is the part where we play on all type of games. Another thing they do about this student lounge, y'all, they have like books, like extra books. Like I said, the honor code, people donate these books and leave them in here. It's okay for you to borrow them, but the unspoken rule is to bring it back if you borrow it. So, yeah. A lot of these books you will use in your first year of med school. And I guess people who graduate, they're like, I don't need this book no more. So, yeah. Like this book. It's your biochem book. I don't think I used this one.
Oh, God, I did.
You did?
I did.
I think because I took biochem at Mississippi College.
Yeah, you were very well off with that.
Okay. And I guess while we're in the lounge, it's a good time for me to answer this question. So this question was, how do I balance my personal life with medical school? Medical school, it's hard. You have to really be about time management, prioritizing yourself. Like, right off the bat, your first year of medical school, probably your first semester, that's something you're gonna struggle with. Like how to find that balance, like time to play and time to study. You won't have a whole lot of time to devote to that. But it just goes off of knowing yourself and knowing how much work you need to put in to, you know, do well in your classes, and knowing, you know, how much time you can spare to do whatever. It's very important though not to neglect like your own needs. Like you need to relax. Like there are times like you will get tired of studying and you have to listen to your body and say, let me take a break. Me studying for another hour, you know what I'm saying? Is it worth me studying for another hour? Or should I go take a break for this hour? Like, cause sometimes in medical school, you can study for so long just to get the same grade. These tests in medical school, they're not like the tests in college that you probably don't have to study that much for and do well on. Like in medical school, you actually have to like study for a long time. And even if you study for a long time, you might get the same grade. I think some students struggle with that in medical school, like knowing where they fall amongst their peers. In med school, you're not the same, well, you're not the smartest person in the room anymore. The room is full of smart people, and it's hard for some people to, you know, I guess, accept that, but there's nothing wrong with that. Look at this. This is a plastic bag drive that student physicians for social responsibility are doing. They're donating these bags, I think, to Stew Pot.
Mm-hmm.
Yeah, they do that. That's really nice, because Stew Pot, if you don't know, they have a food pantry, and basically, I remember last summer I volunteered with them to distribute food to elderly people, and you'll basically be using plastic bags to get the groceries out of their food pantry. So sometimes they run out of plastic bags. Yeah, so a very small contribution goes so small, goes so far. Nobody ever thought like, let me get my plastic bags and make sure they have some. But it's very useful for them to do that. Okay. Talk about all this stuff. Okay, checking on what I look like.
You look great. What is your favorite thing to do post-test?
Oh, that's a good question. Okay, besides playing Super Smash Brothers, my favorite thing to do to post-test is be lazy. It's kind of weird. Like when people ask me what is stuff I like to do in my free time, it makes me realize how much free time I don't have. And so I'm like, am I having like a traumatic response to this question?
Do you hear me?
But after a test, I like to do stuff like my hobby is social media. So I like to go and like put out content on my social media page, or go on my YouTube page, or like read a book. If you watched the story earlier, I was suggesting books for pre-med or current medical students to read. So I like to read a book that, like, you know, helps me learn something in my leisure time when I'm not reading a textbook. Yeah. I also like to go out. I can't do that too much, but like I used to work at 4th Avenue, so I like to go out, do that, get a couple drinks with my friends, go to M-Bar, get some chicken wings, stuff like that. Let's see here. That pretty much covers the bottom floor. And the flooring here is interesting. This is not the first floor. This is B.
This is the ground floor.
G. It's
this
G.
This is the ground floor.
It's the ground floor. We're about to go to the first floor. Little up some steps. I'm sure it's looking. Mama?
That's what we be saying when you be trying to work out. Be like, what's she have to lose?
I'm still working out. Let's go over here first. Like, okay. Stop and look. This is the legacy wall. This is like walking past a history lesson of UMC like every day. They got a lot of stuff on this wall. We can just look at it real quick. I'm not gonna read it to y'all, but a lot of things that contributed to like UMC, they got it here. I bet y'all know who this is. This is Dr. Aaron Shirley.
Who is?
Wait, what you mean?
Huh? No, I'm saying who is my house leader?
Oh yeah, they have a house program at UMC. Let's talk about that as we go to the lecture halls. And see, going this way, it continues the legacy wall. You sneezing? Or you yawning?
Yawning.
Okay. We can probably go in the M1 lecture hall, but not the M2 because we don't have no service in there.
Oh yeah, we don't.
We don't have no service in there. Hold on. I'm sterile.
Now when you touch this door.
Hold on, let me see if anybody in here first. Okay, come on. Ain't nobody in here. Okay, yeah. So this is the lecture hall. You can just take a second to show them how big this lecture hall is. All these chairs, man. It's a lot of chairs, right? So this year, a lot of the students are like virtual. So these two students here, they're virtual right now. Last year, we were here in person. I'm trying to think, where did I always sit? The third row?
Third row.
I used to sit kind of where she's sitting, right behind her. But I also sat back here.
When you didn't want to be seen.
I think this was like my seat right here.
Yes,
right here,
that was you.
This was me. Yeah. So this is the M1 lecture hall. So a lot of the classes that M1 have, they'll be in here. The only thing that changes is the professor. So you just sit in this class from like 8 to like whatever time they let you go today, which might be like 3 or 4 the first year. So the house program at UMC we were mentioning is basically named off of a lot of historical figures at UMC. My house is called the Guyton House. And it's really like Harry Potter houses. They sort the students into these different houses. I think it goes off of like your M2 buddy. So whatever house your M2 buddy is, you're more likely to be in that house. I want to go ahead and just say you're probably going to be in that house, like definitely.
Do you want to explain the M1, M2 buddy thing to me?
Oh, yeah. Okay. Let me talk about Guyton first. Guyton wrote the book of physiology that a whole bunch of med schools use. Guyton Hall's physiology textbook. And let's talk about the M1, M2 buddy program. So when you're coming into medical school, you'll have, you'll be paired or you can request someone who's already in medical school to be your M2 buddy. And so what is M2 buddy? Basically like your mentor, like your upper level mentor. They can like give you old books. They give you advice on how to study for classes. Basically any kind of question that you have, like as a student, you can ask them. My M1 buddy is Kiana Hilton. She couldn't be here today, y'all. But that's who's supposed to be helping me out with this. But if you look on the admissions page, there's a post about the M1, M2 buddy program. So I really like it because it kind of brings you in knowing somebody to reach out to, talk to, give you advice. So you're not in it alone. I think that's like a big thing about medical school is to make sure that you know, like you can't do this on your own. They don't just throw you in there for you to just like think for yourself.
We have a question for you. Did you feel that attending MC prepared you for medical school?
Attending Mississippi College? Yes. Like coming out of Alcorn, I don't know. My Mcat score wasn't where I wanted. But Mississippi College, like they do a great job with preparing like students to come to medical school. They send a lot of I think 40-some students probably to medical school here, like a year. Hey, y'all want to be on my Instagram live?
I don't want to mess up what you got going on.
You good? Okay.
That's our class president, and that's Jacob, and that's Ben.
She knows everything.
Jacob, that's our class president. That's my class president. You want to say hey? Say a few words, Jacob.
Hey y'all, just listen to Haley. Just trust her. And really, what are these, prospective students?
Probably so, yeah.
Okay. Well, best of luck with your journey. It is one for sure, but just keep pushing. Use our resources like Dr. Haynes and everybody, Haley, anybody else connected with our social media, and they'll have you covered. So good luck, y'all.
Thanks, Jacob.
Yeah. See ya.
See y'all later.
I put him on the spot.
We love to do that to Jacob.
What was I talking about before I got on here? What was I talking about?
We were on Mississippi College at some point.
Oh yeah, like I was saying, like Mississippi College, because they're like the classes that they're taking are classes that you take in medical school. And it's not even just the classes that you take in medical school. They teach you on a med school level. The thing about medical school, and I talked about this in one of my YouTube videos, it's basically like it just keeps going. You learn something one day, you're gonna learn something else the next day. They're not gonna stop and go back, basically. It's like, what's the analogy? Eating pancakes every day. Like you get 3 pancakes today, you're gonna get 3 more tomorrow, 3 more the next day, 5 more the next day, and you're gonna get tired of eating pancakes, but you gotta make sure that you're eating those every day. So making sure that you're getting your work done diligently as they continue to give you more. So that's what they do at Mississippi College, which prepared me like coming into UMC, how to like make sure I'm up to studying at that intensity, I guess you could say. So some more study space they have here at UMC, like on the sides. People can sit here and study. Look at the natural lighting. You're not trapped in a book. You see this? That is the rest of the world right here. While you studied in the book, it's all right there. We have some this is like this same thing on the 1st, 2nd, and 3rd floors. They have these study rooms. I'm gonna sit somebody in here. I don't want to expose them. Ain't nobody in here. We sit in here. So this is like for 1 or 2 medical students.
It used to be up to 4, but COVID, gotta be safe.
COVID, so max occupancy of 2 students per room.
Oh, you're good.
It's about now. So you got a whiteboard. They give you some markers. You see somebody, what they studying? Renal. This is renal physiology. I don't miss it. I still gotta know it though.
They give you a monitor
You got a monitor?
that you can broadcast your screens and stuff to. If y'all want to go over things, you can do that. Or you could be like us and put the game on the TV while you study.
Do some of everything. So yeah, students use these study rooms over here to study. We're gonna look at a classroom that we study in too.
While we're doing that, how much time in your day do you spend in school studying?
Wow. So in 1 year, you have a lot of mandatory classes. So the way UMC does their classes, and you need to when you're applying to school, make sure you're knowledgeable on their attendance policy. So UMC, they have classes that are mandatory and they have classes that are optional. They encourage you to go to all your classes. You should go to all your classes. But mandatory classes, you actually have to be there. And if you miss a certain amount of those, then you'll probably get contacted about not being in class, something along those lines. Didn't happen to me because I made sure I was in class.
That's been nice.
And those are normally clinical rotations, stuff they require, have to make sure that you're getting this information in medical school. So you have a lot more mandatories in 1 year. In 2 year, I don't know how many mandatories have we had this week.
No.
We probably had one mandatory.
We had 2 because the CBL and the GCR.
2. So one is a clinical based learning, and then the other one is what's the other?
Guided case review.
Guided case review. Yeah. So we have those 2 things in 1 day. So in 2 year, you have more time to yourself where you don't have to be in class. And as far as studying, in 1 year, you're going to be studying all day, every day. Just go ahead and get ready to do that. In 2 year, you can decide when you want to study, but you still have to study just as much, if not more, your 2nd year of med school.
Would you like to explain the difference in testing between M1 and M2 year?
Oh, yeah. So in 1 year, you have tests every Monday. That's why they got what's called med school Mondays, because after your exams on Mondays, we normally have some free time before we get back Tuesday and start learning. So we have a test every Monday. Y'all want to be my Instagram live? Sure. What's up?
Right.
These are my classmates, Matt and Ruhi.
This is Matt.
Hey guys,
They're the goats.
Say hey to my followers.
you guys are the goats. Hey followers. Haley's great.
So your first year of med school, you have a class every Monday. And it's not on the same stuff. One Monday it'll be biochemistry, The next one will be gross anatomy. The next week will be histology. It'll probably cycle like that. But so you probably have like 2 to 3 weeks of information every Monday. And so you just kind of like gotta stay up to you know, par. So imagine having a test every Monday. You studying every day for that test. Okay. So remember, like I said, we got like classes up on the wall. I'm gonna show y'all the classroom I'm currently in. So we're welcome to use these classrooms if they're not currently being used for other purposes. Sometimes they have like trainings and stuff going on in the classroom, but we're able to use these classrooms to like study in, and like groups of students given COVID regulations as an occupancy, I think of, what is this, 10 students? Yeah, have to wear a mask at all times. We're studying in groups, but this is where I was this morning studying while I was giving y'all little gems. I didn't have my mask on because I was here by myself. But yeah, we can write on the boards. We can't rearrange these tables because they have them like stuck together. They want to keep it a certain way. But we're allowed to use these like 24/7. And the med school was open 24/7 for us to use.
Literally left here at 3 a.m. last night.
Oh gosh, you heard to 3 a.m.?
Yeah.
I ain't gonna lie, I did that before. I pulled an all-nighter.
Oh, you want to show them a classroom with lighting?
Oh yeah, is somebody in here?
That's mine, I think.
Hey Eric, you want to say hey to my Instagram live?
Meet first year medical student Eric Lucas working hard.
Say hey Eric.
Our physiology teacher is doing pop questions.
He's in class right now.
We're in class right now.
What's it like?
Huh?
What's it like being a first year medical student, like virtually?
It's convenient. And I think that's probably the best thing I can say about it. It allows you to make your own schedule. It forces you to definitely be strict on your time management.
Yeah.
But other than that, it's a little less stressful, I guess, not having to be somewhere at a certain time.
Yeah, because you can kind of do class anywhere, huh?
Yeah, you can do it anywhere. Look, I was at home yesterday, now I'm back here, so you get to go home and see folks and see what you're working.
Any advice you want to give to anybody who's applying, who's incoming?
Don't be discouraged. Keep trying. Always push forward and don't give up.
Where'd you go to undergrad, Eric?
I went to Mississippi State, so Hale State, class 2020.
Okay, that's what's up. Thanks, Eric. We're going to let you get back to class.
All right, y'all have a great one.
You too?
Did you get
No, I
Okay,
didn't.
Good. I'm glad you didn't get that.
Got a question for you while we transition. Do you have a dress code for class?
Okay, yes. So the way they tell you for virtual class, unless they specifically say so, you don't have to dress up, but you do need to be presentable, okay? Especially if your camera's on. Like, you don't want to sit there in your tidy whities or something. For virtual class, you want to look presentable when you have your camera on for virtual class. Now, there are days that are called PA days where you have to wear professional attire. And there are policies on that for men and women. You have to wear professional attire with your white coat. I think men are required to wear a tie. Women have to wear like skirts that are like knee length or pants, no ankles showing. There's a lot of stuff that goes into it. So yeah, other than that, say like my first year medical school that was in person, if someone was coming to speak, we were required to wear professional or something. Because I mean, it's kind of weird because your first 2 years of medical school are basically like you in college or like, you know, getting a master's.
I'll do that. Never mind. It came back.
I feel like I was talking about something. Oh yeah, let me get to the top of this here. Let me talk about, let me, oh yeah. Oh, don't touch it. Yeah. Is it shaking?
No, it was. It said pause due to poor connection, but it's good back now.
It's still here?
Mm-hmm.
Okay, cool. So 2 questions I got earlier. How does UMC doing direct rankings affect the competitiveness of the class? So, I mean, rankings are pretty much like every school you go to, kind of professional, whatever. But in medical school, you just have to accept that there's like a certain level of competition or competitiveness that happens. Like, you have to be competitive when you're applying. And in medical school, you're still applying for residency, so that competitiveness doesn't stop. One thing I want to say is that there are just students who like are competitive in their own ways. You can be competitive with grades, which really because of ranking only like a good number of people are competitive with grades, and then you can be competitive with community service, you can be competitive with research. So finding your niche and sticking with that, but also trying to be a well-rounded applicant is something to focus on in medical school. When I wrote something for that, yeah. But like I said, you're not the smartest in the room anymore, so it's important that you like are doing well in your classes, but also trying to do other things like getting involved, being able to like show that you're adept at doing different things in medical school and not just studying, like showing your personality in residency and getting involved in things that you're passionate about. I had one more question, and this question was, what have been some traits of your most successful students? Hey, what have been some traits of your most successful students? So I'm gonna tell y'all what I think is a trait of me as being a successful student. So being open-minded to everything you're learning, as well as being eager to learn. So asking questions, being engaged in class, knowing how to prioritize school without neglecting your personal life and your personal needs. And then finding mentors, people to guide you in the process, and making friends or colleagues or people to study with, people to share your experiences with, because it's very important to have a support system outside of medical school. That's your family, your friends who are not medical people, but it's also important to have people that are also going through the same thing as you, because they understand you better because they're also going through it. I have a few more things. But yeah, focusing on your own journey and being happy throughout that. Because like, one thing I always know is like, don't be the type of person that says, I'm gonna be happy when I graduate. Be happy as you're learning. You know what I'm saying? It makes the process better because it's a long process. And holding your happiness and depending it on something that hasn't happened yet, when it happens, it's just gonna happen. Like, it's very short-lived. So just enjoy your journey and don't compare yourself to others, because you could have a classmate that's researching some type of amazing vaccine or something, and you just sitting up here trying to pass your test. But you can't compare yourself to others, and it's hard to do. But once you learn to like focus on your own journey and worry about what you like to do, it's like makes the process all the more enjoyable. So those are some qualities that I think are successful, will help you be successful in medical school. Okay. So this is the student mail room. You got mail in here. What's the thing on Blue's Clues? You just got a letter.
Oh,
You just got a letter.
We don't do phone calls during this.
Okay, so I think this is cool because we have different things. Like we have a bike. Is this broke?
Probably so.
I'm sorry, don't advertise it. Do this one. It's basically like a bike with a desk. It basically like helps you study better, to be active while you're studying. And then they have treadmills that you can like sit something up here and read it and be walking and stuff. And I did that before when I was sleepy and studying, but I try not to like make myself be too sleepy and study no more. And there's also a workroom in here. Some people study in here. I don't know what lights is.
Basically an extra study room.
Yeah, it's like an extra study room. I see people studying in here. So it's pretty nice.
People pick up like their little things that they'll buy.
Oh yeah, their jackets.
Yeah. It's been here for a while though. Oh, that's Jamel. Text her.
Now you can see down to the first floor. Just lots of open space.
Natural lighting, natural lighting. Ooh, sorry, y'all.
This place looks better than my apartment. That's why I don't mind studying here. But yeah, there are a lot of different places to study here. I'm just gonna give y'all a sneak peek of some desks over here. Let me show you like right here first. Hold on. You show this one.
Okay.
Is an example of like a study desk. It's a nice cubby. You got some lighting, some plugs, outlets. And let's get, I guess, we're gonna disturb the students that are currently studying. Stay hard, guys. And down that way, it's similar to what we saw on the first floor with more study room and more lighting. Just, I think it's building great. I'll make sure I answer all the questions I got before. No, I have. I did. I didn't answer our questions. It's on the first floor. So the first and second floor are very similar. And then we're going up to the third floor. What's something else I can talk about? Let me go to the Ophthalmology Lab.
Do you want to give them an idea of like what classes you take in your first 2 years?
Hey, yeah, talk about that. Okay, so first year of medical school, the classes that you'll take will be biochemistry, histology, gross anatomy, and then neuroanatomy and physiology, and then intro to medical professions. Those are classes you take your first year. Here at UMC, they're not yet on a systems-based learning. I forgot what it's called if it's not system-based.
That's what it is.
What?
It's systems based.
Oh, they're system-based? Then what's the other one?
No, we're block based.
We're block-based,
We're
okay. And
system.
the other one is system-based, where you go through like cardio, renal, or something like that.
Mm-hmm.
Okay, and so on your second year, which is what I'm in now, you're taking pathology, microbiology, what's the other one?
Farm.
Pharmacology, and then neuro, like in psychiatry, and also intro to medical professions too. So intro to medical professions, that's IMP, you're learning basically like skills of interviewing patients, how to be a doctor, your first year, and then other ways of building rapport. Second year IMP is more about coming to diagnoses and things you see in clinic with your patients, how to look at different lab values and stuff. It gets more in the weeds there. So these are our labs. We're gonna look at the Hysto Lab. So histology is looking through a microscope at different organs and stuff. I wonder if I got a class going on in here. Let me see if it works for me.
Oh, it did. Hey, that's lit.
I don't know what the lights say. Oh, here they go.
This is state of the art, y'all.
This is the histology lab. Woo, 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 one of my favorite classes. I joke. So yeah, basically students are in groups of 2 per microscope. This is what it was my year. I don't know if it's different. I don't think they use the lab this year. They do it virtually. But in my year, it would be 2 students per microscope, and they'll be on monitors. You can see what's on your microscope by looking at the monitor, or you could look into the lens of the microscope. And it's like, you can look at it through there. I never really looked at the microscope because it be pulled up there. So it's so fancy. And the professor, they can pull up slides and project them on the screen up here. That's how we'll do our quizzes. Lab quizzes in micro will be like, kind of like speed dating with microscopes. Like each station, you have a minute to look at it and then identify what's on the microscope. So yeah. You stay here, we leaving. Okay.
Oh,
Oh, look at that tripod.
they're trying.
Fancy.
Yes, ma'am.
Okay.
Heck, you too.
And so that's the histology lab. We're doing good. We started at 11. I can't imagine trying to do all this at, what time?
11:30.
Right, we've been running. And that's the bacteria, parasites, fungi. And so we'll go in the lab and look at that. So far this year, we just did like gram staining and looking at different hemolysis techniques. But I don't know, it's probably we would have done more if COVID wasn't a thing, but that's a micro lab, looking at microorganisms. Let's see here. I ain't got no more questions. We got some time to kill. Let's go upstairs. This is the training center. Is that what it's called?
Yes.
Yes, training center.
I'm trying to take a stroll through here.
I don't know why I'm scared to go down here.
The light ain't even on.
The light ain't even on. Don't do it, I'm scared.
Come on.
Oh. They gonna come here and tell us to leave. But this is where students learn like life support, basic and advanced life support. They might have a class in here. They might have a class. Let's just go make this way.
Here we go.
But this is where students learn like basic and advanced life support skills. I think this whole hallway is dedicated to that. I think they also have a class going on, so we won't go down there and disturb them. I like putting people on the spot though. So yeah.
So yeah, basic and advanced resuscitation training center. Y'all don't know how glad I am this is the last floor of walking. We can show them some of the simulation.
So, this is simulations. This floor is like for interviews, where we do our simulated clinical encounters, and what else we do on this floor? I think that's what it is.
Any regular, if you want to practice suturing
Yeah.
and stuff like that.
A lot of basically a lot of simulations up here. We have like sim nights. So at UMC they have a bunch of different interest groups basically for every specialty. You got like OB, like OB-GYN, family medicine, ortho, anything you're interested in, there's an interest group for at UMC. And so the interest groups will put on simulation nights where they will teach you different skills that you could use in the specialty. Like for example, one simulation I signed up for was it was anesthesia, and they're gonna do stuff dealing with the airway and getting IV access, and I can't wait. I'm finna show y'all something. So we got some more class pictures up here. So one day out of curiosity, I come up here to try to find who's the black person, well, first black person I noticed. And the earliest picture I could find of an African American, just based off looks alone, was in 1972, and it was James Oliver. So, first African American person to graduate from UMC. I looked back all the way back, I couldn't see nobody else. So,
That's lit.
yeah.
Man, I never even did that.
That's the first African American man to graduate from UMC. I believe he's at Howard now. That's what I think.
You're right.
Yep. So there's a little trivia fact, you guys. 1972, James Oliver. 1946.
You want to show them some of the sim rooms?
Yeah, we're gonna go to the ophthalmology simulation. So I'm gonna show y'all a simulation that we're required to do as second-year medical students. It's the ophthalmology simulation, where you're looking at someone's eye. I'll go this way.
It's so triggering.
Not even triggering.
Is you trying to find these little shapes? And I swear I got cross-eyed doing it.
It's very interesting.
That's how I knew. I was like, I can't be an ophthalmologist.
My hair looks a mess from the back. Oh God. I can see myself here. I'm watching myself in my body. So there's always one person watching. Okay. Well, let me show everybody in here first.
And you did it by now. Ooh,
Somebody here.
sassy.
How's it going? Good. You want to say hey to my line? Yes. Come on.
This is Miss Reese.
Miss Reese works in the Department of Admissions. Telling y'all, they're the nicest people.
I promise you, we love her.
Yes, and we love our medical students. They're doing such a fabulous job.
Jeez.
Haley and Robert, you guys are the best. You're doing such an excellent job. Thank you so much for doing this.
No problem, no problem. We have actually something planned in the simulation center at 12. So I was gonna show them the ophthalmology simulator, but there are 2 students in there, so I don't want to just like be in their face.
Okay.
Yeah. I was telling them earlier when I was on the first floor walking past your office that the admissions basically at every medical school is like your first impression.
Correct.
And I was talking about how UMC, you guys give a great first impression because you guys are so nice and so willing to help students when they're applying.
Yes,
So
it's amazing.
y'all definitely passed the vibe check. I really love the admissions, and I said I still live in there. I do that.
Thank you for that, Haley. We appreciate that, and you're the best for being here at this medical school.
Yeah.
And you guys are really going to make a big difference. Even for the M1 class that's coming on board for August, you all are going to make a world of a difference for them.
We
I
love
can't
you.
wait.
You'll be able to have that opportunity to share with them what we have here for them when
Yeah.
they get here. So I'm excited. Thank you so much for allowing me to be a part of the virtual tour.
No problem.
All right, take care now.
Thank you.
So, do y'all have any questions? We have like, what, 10 minutes?
You want to let them? Y'all want to try jumping on
What?
live with you?
Anybody want to join my live? Like, no, I don't want to put them on my live. I'm just wondering what they might do. I don't trust y'all.
I'm dead.
And I'm telling what they might do.
If y'all have any questions, put them in the chat.
Any questions? We have 10 minutes. So what we're going to do is we're going to go into the simulation center and we're going to do some fun stuff. So, yeah.
We lit.
Yeah. Robert, you want to talk about yourself for a minute? I can help you.
Oh goodness, no. It's all about you at this point. What was the toughest part about getting into medical school to you?
Okay, the toughest part about getting into medical school is the MCAT. M-C-A-T, the MCAT was the hardest part for me. I just was getting used to the testing, like questions, or they ask questions on there and learning all that information. Let me tell you something. I don't use organic chemistry or physics since I've been in med school. I don't know why they got on MCAT. I think it's just like you need to know it for other stuff. But MCAT is definitely a hurdle that pre-med student jobs have to face or whatever. My advice is to try to do as well as you can. I actually have like a whole video on this, but to sum it up, like when you're studying for MCAT, questions. Like you can review and read as much as you want, but until you get used to working questions and knowing how the MCAT is going to ask you something, you just basically have to get used to applying the information that you know to actual like questions they ask you. So the MCAT was the hardest part, y'all. Another thing I did when I was applying to medical school wasn't the hardest, but when I shadowed at UMMC, I made sure I got a letter of rec from the person that I shadowed. And I thought that was like good because one, he was a neurosurgeon here at UMC, and so pretty sure when he wrote his letter of recommendation, he used like the UMC letterhead. So it's like knowing someone, you know what I'm saying, kind of on the inside to vouch for you is a big like plus, I thought. So, and I spent a long time. I shadowed for like 6 to 8 weeks. So you probably won't have to do it that long, but if you shadow, don't just shadow one day and ask for a letter of rec. If you can, try to shadow over some time and then ask for a letter of rec so they can speak on like your characteristics, your work ethic, and just like more about you than just a day or a few hours of shadowing.
How did you go about financing your admissions process in medical school?
Financing? Ooh, that's a good question. So financing my admissions process in medical school, let me say I didn't apply for the reduced. What was the other thing you could apply?
You get a waiver for the MCAT?
Yeah, I didn't do that. I really just like kept begging my mom for some money. That's why I was like, I'm gonna apply one more time because I'm tired of asking her for money. And my parents, I don't have any doctors in my family, so we don't really come from a whole lot of wealth. We're fine or whatever. My mom's, she's like in politics, she's a judge, so we're fine off. But I just, we didn't have a whole lot of money to keep wasting on that. So that's why I was like, I'm gonna apply one more time, and then I guess I gotta find something else. But it wasn't like me applying and being lazy about it. Like I put so much into my last application, and I was like trying to be confident that I would make it. So financing my medical school application process, there was a lot of saving, working jobs and stuff. So I think that's kind of what I did.
Got a question for you. Shout out to USM Maps. We're both members of SNMA here at UMMC. What is some advice you have for getting clinical hours and shadowing during COVID-19?
And so I actually heard someone from admissions talk about it, but I think there are different virtual shadowing options that you could do. I think one thing that I know of is like called the pre-med trap house or something. You heard of that one?
Mm-hmm.
Like it's called the pre-med trap house, and they do virtual shadowing, and you have like a quiz at the end, and you get like some type of certification to show that you showered for your hours. But one thing I did know, and I heard this like said in admissions, is that like once like people are allowing students to come in person to shadow, they won't accept those virtual hours. So be cautious of that. Make sure that you're up to date on when students can shadow, and once that becomes available, in-person shadow, and try to do that. But right now, try to get involved in these virtual shadowing hours. And that's what I can offer as far as like getting clinical and shadowing hours.
Some doctors have telehealth that they allow students to jump on with them while they're doing telehealth cases. Yeah. So that's a good one to do. Just reach out to your local doctors and see what they're doing. And a lot of times you can get plugged in that way.
Oh, this sounds plugged in. Is that not called?
y'all. Look, it's Dan, Dr. Coleman.
Thank you all so much for doing this.
It's so awesome. You just ran to Miss Reese.
Really?
Yes.
We finna.
It's your group, Patrick. Okay.
Yep. You want to say anything to my followers? They watching.
Hello to everyone. Thank you to Robert and Hager for doing this. They are two amazing students. And if you guys have any question, you can always reach out to Colin.
Okay.
We love Dr. Coleman always has you good. Right.
Right here.
We're going this way?
Yeah, we're gonna show you our airway lab. in the
So
simulation
good.
center.
Okay. So we're going to do an airway lab in the simulation center.
Hi, how you doing? Good. Okay, Haley, one question for you. Not having any doctors in your family, how did you get information for what you wanted to do in the medical field?
So yeah, I didn't have any doctors in my family, but my cousin, she is at the time she was like in medical school, or she graduated and she became a dermatologist. So me and her are the first doctors in our family. I would talk to her. I reached out to other people who I knew were in medical school and tried to like find doctors in my area. And that's what was the program that used to be UMC that's not here at UMC anymore. MedCorp. Yeah, they offer like shadowing. So I went through their program, and I just basically met people and asked for their advice. So it was hard because I didn't already just have something in place to give me advice, but I did my best to find my own.
We have the Promise program now, thanks to Dr. Dan and Dr. Haynes.
Oh yeah, the Promise program.
So this is one of our tax training rooms. This is where we actually practice airway skills. These are our airway mannequins. We also have CMAX with cameras here. I'll demonstrate here in a minute. We also have a ventilator and a vent trainer over here that we use sometimes.
Okay, full disclosure, I have never done anything in the airway lab.
Word, this is new to us, just like it's new to y'all. This is my first time out of a book in a while.
This is airway Larry here. We have airway rolls, different things here, camera here. Let me see, we'll open up a roll. That's for you. It's not always as easy as I'm gonna make it look, but I'm gonna show you what it looks like.
It's never that simple,
You gonna
y'all.
try?
Yeah, I'm gonna try.
All right.
It's never this simple when you actually have to do it.
Oh gosh. Make sure y'all don't judge me if I don't get it.
I'm judging
All
y'all.
right, so here's your two. So first of all, we'll bag our patient, pre-oxygenate with a bag here over. So I should get chest rise every time I squeeze the bag. Now normally, if a person is breathing, they're breathing room air, about 21% oxygen. So if they pass out, they have about 3 minutes before their oxygen saturation starts to drop. When we pre-oxygenate them, we're using 100% oxygen. This is usually connected to oxygen. So you have about 5 to 8 minutes before they actually saturate. So it gives you a little more time to intubate. All
Come on,
right.
before they pass out.
Yeah, well, no. Once you pass out, you know, the sat starts to drop.
Oh, okay.
It's not breathing, I'm saying. I should say. Yeah.
Okay.
But if you pre-oxygenate them to 100%, using 100% oxygen, they have a lot more time before they saturate. All right, all of these are designed to be held in your left hand. Sorry. The light source is on your right, so you hold it in your right, you block your view. Reposition the head. I'm gonna follow. Looking in the mouth, on the curve of the tongue. Find the epiglottis. The tip of this particular blade goes between the tongue.
Post on the screen.
The epiglottis is up there. So I'm gonna pull up and away. And this little white portion here, vocal cords. So I want to actually see this tube go through those vocal cords. Of course, I wouldn't have enough of it being in it. Okay. Now this is a size 7 tube. The depth of the tube is going to be 3 times the size of the tube. So you have these little numbers on here. I want to be 21 at the tip.
Okay.
Has a cuff. We inflate the cuff. Move this dowlet. Now you should see the chest rise when I give a breath.
Oh wow.
That is a successful intubation.
That did look so easy.
You made this look
You
so
made it look
simple, y'all. I promise you, you're going to mess it up so many times. They asked, how does this not choke them?
Well, they're actually unconscious, so
Mhm.
they don't have a gag reflex.
Yeah.
No gag reflex. So they won't cough. Good question.
That's a great question.
Yeah.
Wow.
All right. I will get you two ready.
Okay, where my tools at? I'm nervous. I ain't never did this before.
You're gonna do great.
I'm so glad they have this so you can do it on airway larynx first.
Yeah, you can do it.
Could you imagine doing this on your patient first?
I couldn't imagine doing it on my patients first.
All right, so now grab that one,
Okay.
just like that. Oh, that's it, just like that.
Mhm.
You're gonna position his head, what we call a sniffing position. Now
Mhm.
just follow the curve of the tongue. Now once you find the epiglottis, that little space right there, that's where you want it. That's where you want it right there.
Okay.
And you want to pull up and away. Now, wait a minute.
Am I supposed to be behind it or in front of it?
Right here, you want to be midline here.
Okay.
There it is.
Oh yeah.
Hey,
Y'all see it? Oh yeah.
she got it.
Now, you have one issue.
Mhm.
You're not gonna be able to get your tube in here.
Okay.
There you go. Now, you ready?
I'm not. Okay, I'm midline. I think this
All
is
right.
good. Okay. I'm supposed to follow it.
Yeah. You can actually see it. Look at you. Look. What?
I'm a natural. I'm a natural.
Can't wait to
Is
see
it in
this.
21? Let me see. There we go.
All right, so we'll inflate this.
I can pull this out now.
Pull that out. Pull what we call the stylet out.
This.
Yep. And now, give a breath, and we should see the chest rise.
Look at that chest.
Look at that.
Look at that chest.
There you go.
Look at that chest. I'm a
We
natural.
love to see it.
That's awesome. Rob, do you want to try?
Mm-mm. You're not finna embarrass me on this live.
It's not even that bad. I just pull it out now.
No, what do you mean?
Yeah, but you're natural
gotta
at these type of
uninflate it.
things.
Yeah, I'll show you what it looks like. I didn't even show you, but
Yeah, what is it like
once
with
you put it
inflation?
in, it has this little cuff here.
Oh.
Yeah.
Okay. That's the same thing with a catheter.
Mm-hmm.
Yeah.
Look at me. I'm a natural. Sorry.
I can't stand her.
That was
Is there anything
fun.
else you want to see?
Oh.
Yeah, you mind taking up on the other side and showing some of the magnets, y'all?
Oh, yeah.
Oh, yay.
Oh, that's good old Harvey. I wanted to play with him.
Harvey?
Is that the one with the microphone?
Yeah, it's Harvey right here. You coming?
Hi, Galena.
Hey, what's up?
He's in there doing the eyes. I'm sorry.
That's why we ain't going
Oh, I
in
just
there.
I forgot that was in the
Y'all
same
can come
thing.
in.
Oh, we can? Are
Yeah.
y'all sure?
Yeah, we're just finishing up, I think. Or, I mean, they are.
Okay, we ain't want to impose on y'all.
No, you are good.
These are our simulator trainers they're working on there. And this is Harvey.
Hey y'all. So we're doing a virtual tour of the School of Medicine. So we're just like showing different mannequins we have.
Go for it.
Y'all, kid y'all not, that's the most triggering thing over there.
I'm
I could not.
Yeah, so that's the ophthalmology simulator. So that's like teaching us how to use an ophthalmoscope and look at the eye. It's all like virtual. There are different shapes and stuff we have to find in the eye. Yeah. I used this guy before.
This is good old Harvey.
Yeah, it gives you all kind of ear sounds and heart tones. As you can see, I don't know if you can see it real good, but these are all the different, on
Yeah.
both sides, everything actually changed.
Yeah, I listened to him. I used him one time. I just came up here, honestly, and I put the numbers in. And
You
I was
turned them
listening to
on?
different murmurs.
Oh,
just started putting them.
lit. That's
You
what
can
I've been
listen
wanting to do.
And it, like, if you hover over the areas like the aortic valve, pulmonary, you can hear the different, like, murmurs. You just have to put the number in to tell you.
And this room is bad access, so you can come in here anytime.
Mm-hmm.
I tried that when we was doing cardio, and I was like, wow.
See y'all later.
Look at all this available to
Thank you.
us. Let me grab my iPad.
They trained us so well, y'all.
Are those all the mannequins you gonna look at?
We're gonna show you our stand. Our stand is he's the man around here.
They let us sim like OR training and all of that, birthing babies. It's quite nuts, honestly.
OR is pretty, they did some cancers in there yesterday, so it's down right now.
Excuse me.
Did you know, like, we can actually keep this video on your Instagram page after the live is over?
Okay.
So students just want to see it in general.
They can go back and watch.
Mm-hmm.
If not, I'm putting it on my YouTube. I'll probably put it anyway.
Mm, she will.
Right here.
I'm following you.
So this guy here is one of our patient simulators. It's called iStand. And he is connected to a computer. Actually, I'm gonna put him on. Let you see iStand. He can blink and breathe. He has a microphone. He can talk. He has pulses everywhere you have pulse. He can change his heart tone, breath sounds. All that good stuff. Yes.
You see how far we've come just in being able to teach our medical students?
Hey, Mr. Stan. How you doing? Did he move?
Mm-hmm.
Because I'm going to be scared if he starts moving,
He
y'all.
blinks and stuff. This is what they did. When your first year comes, they do a thing called Primary Care Day, where they let you go through like a whole bunch of different simulations with emergency medicine, internal, OBGYN, and pretty much just like you get to enjoy different simulations like this one.
I just want to say, did y'all see me do that intubation, though? Did y'all see that? Did y'all see me do it my first time?
Mm-hmm. I can't stand
That's how
you.
strong my brain is. It's like,
I can't stand you. I'm not looking forward to the self-assessment I have to take.
the self-assessment.
Mm-hmm.
Oh, what?
The MBOS one.
Oh, yeah, I took mine. So one thing, as a second year medical student, one thing we are dreading is step 1. It's basically like the Mcat with steroids.
Oh my God.
No, but it's basically like
She's lying.
a test over all the information you learn your first 2 years of medical school. Standardized test. Next year it'll be pass-fail. Right now it's a scale or scoring. You basically get a score compared to other people who've taken it with you. And right now my class is taking it. We get a scale score. And I think some residency programs are moving away from using the scale score, but there are still some who will use them basically as a way to get your foot in the door on how well you do on the exam. And step 1 scores in the past have basically been like a way of, I guess, the higher you score, the more competitive specialty that you could like apply for or, be a competitive applicant for. So I guess they'll probably move to using step 2 or like research experience. I don't know. I used to joke about saying if I would have waited 1 more year.
Do you hear me? I said the same thing.
I would have waited 1 more year.
Distress.
That's gonna be okay. Yep.
So it's a great thing they can do with simulators. They can simulate literally almost anything. Like if you have to do a code.
How good this video looks then.
If you have to do a code,
That's
you can
a
do
lot.
any of that. They have drawers that allow you to
They
pull out
keep it
different
really
medications like epinephrine. They have an anaphylactic shock or just administering oxygen. They have that over there. So it's just a lot that you can do, and they're always open to like allowing you to do it.
This is so cool. Yeah, I think his eyes open. Oh, his eyes open. He's blinking. Hey there.
What's
How are
going
you
on,
today?
Stan? You breathing?
Does he got a pulse?
Shit.
Oh, he got a pulse.
Mm-hmm.
Let me see if I can feel the radial pulse. That'll be. No, I can't feel the pulse.
You can feel the dorsal pulse.
I'm trying to see if I can feel it. I thought I felt the breaking one.
He's got one down here too.
He's got one down there.
Mhm.
Maybe I'm not looking in the right place. Lord have mercy.
Right. Sweet. So that should be right here. Yes, it is.
It ain't on. See, I knew what my radial is.
Okay.
There it is, right
Oh, where's it? Right here. Let me
You did that.
there. So, chest rise,
see. Yeah.
breath sounds,
Mhm.
bowel sounds. Again, every carotid pulse, brachial, radial, femoral, popliteal,
So are
and dorsal
what? How can students use this to learn? Do they like practice scenarios or?
Yes, so the main thing here is working on teamwork and communication, biggest thing. So you do scenarios like, for instance, in the ER, you a team coming in to actually evaluate a new patient in the ER, that type of thing. And of course, even here, there's different issues going on. We have a monitor here, which we change the vital signs, and any intervention that you do, we can actually make the changes on the vital sign. And here, you can actually see them on here as well.
Okay.
Say for instance, if he was in respiratory arrest and you intubated him, If you didn't squeeze the bags, his sats would actually drop.
Wow, so this is like very interactive.
Yeah, and if you actually, you put your hand here, you can actually feel it exhale.
Oh yeah, I feel some breath coming out. Oh wow, this is cool. When I get to do this next year? It's probably third year.
Third year.
Third year. Okay, yeah. I'm a second year right now. Oh, this is cool. Yeah. And y'all sit back there and watch us, huh?
Yeah, actually, yeah, this is where we control here.
So y'all see the two-way mirror.
Mm-hmm. They be
This is
thinking.
not a mirror for me to look at myself.
They think they slick.
They do it all the time. This is the computer that controls him here. There's also cameras in the room that I can actually pull up on this computer here. And of course, the monitor is the same as out there. So anything I want to change, I just go in here and change.
So you can control the pulses in different places and
Yeah,
stuff
oh,
too?
everything, yeah.
Oh, wow.
Here. Say for instance, anything cardiac, if I want to change it, I just click on that little heart and I can go over here and change it. Blood pressure.
Wow. I can't wait to do this. I already learned this, so I can't wait to do
She
stuff like
can't
this.
wait. I'm trying not to get embarrassed out here.
Wow, that's a nice, wow.
And he does screen like that.
Screaming?
Yeah.
Yeah, he's screaming.
Is it y'all making him scream? He's screaming on his own.
So,
Oh my gosh.
he has some pre-programmed, little statements.
Oh, okay.
He also has a microphone too, that way they can actually do an assessment, we can answer questions and give history.
Wow.
Yep.
That's nice.
Seems to be you in, what, 6 months?
Mm-hmm. Less than 6
6
months. I
months.
don't know what rotation we do this on, but
Emergency
yeah,
probably.
probably emergency, but that's soon. Yeah.
Mhm.
Okay.
Yeah.
Well, yeah. Is that the last? I forgot what it's called. That the last mannequin?
Yeah.
Yeah. That's good.
I don't have my birth command set up, that would've been good. So I'm using that room for something else.
That's okay. We won't have to shut down.
But yeah, we have pediatric mannequins, neonatal, birthing, what else? Yeah. Task trainers. I can actually show a virtual reality room too, another one.
On virtual reality. So one time I volunteered with the OB interest group. They did OB sim night, and they had he was explaining like a birthing mannequin. They actually simulated childbirth where you catching a baby. They had this virtual one where you did like what was it inside the was it fibroids or something you was getting out of there?
Probably so.
I can't remember. It was some virtual thing.
This I'm going to show it to you.
Okay.
Yeah, and actually the pelvis on that, we can actually change it out. Orthopedic, they can actually do scope knees and shoulders, also have a hip.
Oh, so residents being here and doctors. Oh yeah.
Like she said, you never stop learning.
You never stop learning. So if you thought when you graduate medical school the learning was over, it's not. Like being a doctor is a lifetime commitment to learning and bettering yourself.
And we're here for it.
Yeah, because medicine never stops evolving. It just I don't know, keep coming. Oh yes, it is what I remember.
So that was the bronchoscope, and then you have the laparoscopic over there, and this one is we call it the vertebrae, but I can actually put this knee, shoulder, hip, and we have the pelvis on here now.
This the one I had did the sim night. We was in there like getting rid of the. Is that a fibroid?
Yes.
Yes. Okay. Yeah, we're doing the fibroids on there.
Sneak.
We learned some everything.
We learned so much.
That's why when simulation night come,
Everybody's trying to sign up.
It is hard now because the numbers that they can allow is like reduced. But they used to take a lot of students.
Should I do sim one night during your first year?
Yeah, that was still my first year OB sim night.
Okay.
They did different ones. It was all in this hallway.
Yeah, nothing wrong with letting anybody do that.
They did like
comes in.
They did catheter placement. They did like knot tying. Like all types
Ooh,
of
knot
stuff.
tying. Ooh, goodness, that was
I
so
forgot
fun.
that because it was so like.
Oh my goodness.
Yeah,
Yes.
Yeah, it was fun.
The little ropes and you just.
I have that set up over here too for
Oh gosh.
for 1
I
o'clock.
remember
extra.
that.
Slow over.
It's called a hysteroscopy.
That's good. And I've been told that one of the doctors here, Dr. Perry, actually designed this scope. And he comes over with the fourth year, OB rotation. They actually come over and do this with him.
You practice the hyster. Okay. The fourth year med students or during the residency?
Med students.
Oh, okay.
I'm
Yeah.
guessing that's for people that actually really want to go into OB-GYN.
Mm-hmm.
Because, ooh.
Yeah, so they have some of everything here.
I'm not gonna lie, I could do OB, just not gonna.
It's very interesting. Let me see, what was I finna say? Is there a sim night that you remember going to when you liked? Cause I just remember OB sim
There's a
night.
couple. So being a part of rural, I got to do like family med sim nights and internal sim nights. The internal one was actually about airway and Dopplers with ultrasounds.
Oh yeah.
So that was really cool, getting to do ultrasounds and stuff, like getting to do jugular venous, and doing central axis. So that was really cool. I enjoyed that because it was something I had read about in first year. So getting to actually practice it was pretty dope. I can't lie.
I like how UMC gives you like so many different opportunities to get involved as a medical student. One way I like to get involved is, I think a lot of people know this, but if you don't, I volunteer a lot at the Jackson Free Clinic, and that's the way that I like can work with patients. Like in my first and second year of medical school, the Jackson Free Clinic, they provide health care to uninsured patients, and so in a way it's like, you're killing two birds with one stone. You're providing health care to this person who otherwise wouldn't receive it, and then you're also learning as a student and working with upper levels and physicians who volunteer as well. And so it's a student-run clinic, so it takes a good deal of commitment, but it's very rewarding in that sense. I really like the Jackson Free Clinic.
I wonder if they put a question.
Is there a question?
Ooh, yeah.
It's a long question?
No. Oh, go ahead. Oh, yeah. So, is it? Ooh, did your study habits improve before medical school?
My study habits did improve before medical school because I did a master's program at Mississippi College. So my study habits from college and my master's program changed a lot. I studied more. I studied different ways. When I got in medical school, I kind of kept the same habits that I had in my master's program, but I just used them more often because medical school takes a lot of time and a lot of repetition and stuff. And so, like I said before, like being able to do that in my master's program like helped me already know what worked for me when I got to medical school. So
They say they ask, are you an emergency medicine doctor?
Am I an emergency medicine doctor? Or was they talking about him? Me? No, I'm a medical student. I'm a second year medical student. I got 2 more years until I get that MD behind my name, and I can't wait.
Yeah.
Huh?
Oh, we think emergency.
Oh no, I'm
Anesthesia.
not thinking emergency medicine. I'm not gonna tell y'all what I'm thinking. I have a big reveal. You know how people have gender reveals?
Oh
I'm gonna
my
have a
gosh,
special
she's so
reveal.
extra.
I'm very extra. Okay, so y'all gonna have to wait 2 more years to figure out what I'm
I'm
gonna do.
crying.
Go try and see what's going on with this.
How do you balance medical school with your personal life?
Oh yeah, so that's a good question. It just comes with prioritizing stuff, knowing what I have to do to study and knowing how much time I have to put into my personal life. Whenever I feel tired of med school, I go and do something that I like to do, like social media or read, just take a break, and then I go back to studying. So that's kind of like a balance. It's not working?
No,
It's all right. We don't have to do that
I
one.
gotta do some updates, sorry.
Oh, it's fine. They'll see it when they get here.
They will. We can probably like conclude our tour.
No problem.
Let's come right here, Dan. You can give us some words and say goodbye.
Definite.
Yeah.
I think the biggest thing is Haley and Robert would tell you that the journey to medical school, everybody has their own personal journey. It's not no perfect journey to becoming a physician, but you know, Rob may can go from hit A to B, but Haley may have to take A, B, C, D. But I just encourage you to just stay the course, and go after this. If it's something you really, really want, make it happen. And one great thing I think about UMC that we do is that we really value student input. So if there's any question, any concerns you have, please reach out to us and just let us know if you have any question. And again, I just want to thank Haley and Rob for doing this today.
So there's a question real quick. Do you have to have a really high ACT score to get into med school?
No, ACT score, you know, that's a test, of course, you take during your high school year. There's some indicator that say if I have a high ACT score, that's going to allow me to test well on the Mcat. But to me, I think it's all about perseverance. Like, can you really sit down and focus and learn how to take a standardized test? And I think that's probably the biggest thing they probably can tell you with the Mcat is that you just have to understand the Mcat. The question they ask you are so different than what you may perceive when you read. So definitely, that's not the case.
Yeah.
The ACT is kind of like the MCAT. Once you get into medical school or college, nobody cares about it.
Right.
Yeah. So anyway, you guys, I'm just going to end our tour by saying one thing. No matter what your path is to get into medical school, just remember it only takes one acceptance to begin your journey to becoming a doctor. So always persevere and put your best foot forward. And if, like Dan said, if it's something you really want, don't let one rejection, two rejections deter you. Becoming a doctor is not an easy feat, but it's definitely rewarding. Thank y'all for joining my live, and with that, we out. If y'all want to ask more questions, I'll still be on the live for maybe until 5 o'clock today. So bye. You can hit the end button.
Thank you, Haley. Thank you, Rob.
You just press the X, right?
Yeah, the X. And don't touch it after that.